States across the country are lifting coronavirus restrictions as more than half the adults in the U.S. have had at least one COVID vaccine shot. In Massachusetts, sports venues like this one can increase capacity to 25%. Amusement parks are also allowed to reopen, and grocery and retail stores no longer have to offer senior hours. Illinois is another state easing restrictions this week as it is set to move into what officials call a bridge phase on Friday. Capacity limits will be increased at restaurants, museums, amusement parks, and more. Meanwhile, Connecticut has become another one of the first states in the U.S. with more than 70% of adults to have received at least one dose of the COVID vaccine. The state health department says data shows the COVID-19 vaccine is effective. Over the weekend, Dr. Anthony Fauci was asked, with the results we are seeing, if it's time to start changing indoor mask mandates.
I think so, and I think you're going to probably seeing that as we go along and as more people get vaccinated. The CDC will be almost in real time, George, updating their recommendations and their guidelines. But yes, we do need to start being more liberal as we get more people vaccinated. As you get more people vaccinated, the number of cases per day will absolutely go down. We're averaging about 43,000 a day. We've got to get it much, much lower than that. When that gets lower, the risk of any infection, indoor or outdoor, diminishes dramatically.
For more on this, I want to bring in Dr. Eric Cioe-Peña. He is the Director of Global Health and an emergency room physician at Northwell Health. Dr. Cioe-Peña, welcome. Great to have you with us. So do you think that this current guidance on face masks indoors should change in light of this new information we have?
So good morning or good afternoon. Thank you. I do think that we are heading towards a change. I want to be cautious in how quickly we change. We do have to remember that only 1 in 3 of Americans are vaccinated. And so we still have to proceed very cautiously. But this is the reason why we all were excited about vaccination and everyone getting vaccinated, is that we are going to take a big step towards normalcy. And that is a huge deal. And I think that the more people that we can get vaccinated, the closer we can get to that normal safely. And so I hope that this is the first step of many.
And we mentioned that many states are already loosening restrictions this week. Do you think it's the right time to start doing that?
I think we have to loosen some restrictions smartly. I think we need to show people who get vaccinated that there's a light at the end of the tunnel. I do also think that, if we move too quickly, we could see something like what's happening in India, where our rate of viral transmission is far surpassed our rate of vaccination. So we do have to be cautious. We don't want to end up in a situation like that, but we are well ahead of India. And I think we are starting to see numbers dip because of that, and because the people that are out moving about the world that are at risk are getting vaccinated.
Does what is happening in India, though, concern you in terms of any time there's a surge anywhere on the globe, it could potentially come back here as well?
Yeah, absolutely. There's no safety until we've beaten this everywhere. And that's why my health system has taken extensive steps to make sure that we're sending supplies, PPE, to India to help our colleagues there. We're not done until this is over everywhere. And it does create the risk of variants that could dodge the vaccine, that could be reintroduced into the United States. We know travel bans really aren't effective to prevent the spread of variants. We saw that with the UK travel ban, the South Africa travel ban. It just doesn't work. We have to keep fighting this. But that doesn't mean that we can't relax restrictions in a smart way that allow people to enjoy the benefits of being vaccinated this summer. And I think that's what we're doing.
And speaking of travel, Doctor, we saw a record amount of travelers this week. More than 1.7 million people were screened by TSA on Friday. That is the most since March 12th of 2020. So we're going back pre-pandemic. What should people know who may want to start traveling again now?
I think we need to just bear in mind that the traveling is one of the risk points for people who are not vaccinated to getting infected. The more people that are not vaccinated that travel, they have the potential of infecting people that are vaccinated through that, that small failure rate of the vaccine, and could spread COVID to other people. So we have to be cautious about it. I don't think we're out of the woods yet, and we need to convince. If everyone who's vaccinated can convince 2 of their friends to get vaccinated that aren't, we'd beat this. We'd be done with this by the end of the summer.
But here's the thing, doctor. I feel like at this point, everybody who really wants to be vaccinated has already been vaccinated. And those who are not vaccinated are sort of adamantly not going to get the vaccine, right? So how do you broach that group? I feel like the people who were going to be swayed have pretty much already gone, but there's still, a group who's digging in their heels and will not get vaccinated. How do you approach that?
I'm a little bit more hopeful than you are. I think there's probably a third group that doesn't want to go to a mass vaccination center, wants to have a conversation with their doctor before they get vaccinated, is not in a rush to get it, but isn't adamantly dug in on their heels. It makes me very nervous to think that 60% of Americans are dug in on their heels against vaccinations. I think it's less than that, but there is that second group that's going to need a little bit more coercing, a little bit more of a direct conversation with their doctor that they trust to get vaccinated. And I think we need to start hitting that group, and then we can start working on the people that are adamantly against it and figure out how to reach them.
And what's the latest you're hearing about children, right? That the 12 to 14 age group that's still waiting on FDA approval. Is there any more news on that front?
I haven't heard much. I know that there's a timetable that says that there should be approval for an EUA within the next week or so. I haven't heard any new information about that. We're all obviously eagerly awaiting that for the adolescents. Everyone wants to know whether children 6 months and older are going to be approved before the school year next year. Those are all kind of million-dollar questions right now.
Right. All right. Well, Dr. Eric Cioe-Peña, thank you so much for joining us. We always appreciate it.
Thanks for having me.